What do you think of these guidelines? Did they get it right?
What worries me a lot about these guidelines is where does it come down to in terms of a clinical message in the practice, in the clinician's office, with the patient sitting right there? What are we telling women? We have to remember that women in their 40s and below still get breast cancer. The real question is, what are we willing to do for early detection?
The recommendations encourage doctors to talk about risks and benefits with their patients, but a lot of doctors simply don't have the time to do that. So how does that actually happen in the real world?
Well, particularly in this topic, it's very complicated, and the discussion about the risks and the benefits of mammography have to be specific to an individual woman. So you have to take a good family history, a good personal medical history. You have to be able to, at a particular age, so you have to update this all the time.
In your view, are we overemphasizing now the potential harms, including worry on the part of the patient?
I think the worry issue is something that, particularly in my opinion, is very troublesome as a reason to avoid mammography.
Why?
Well, when I'm getting my blood pressure checked in my doctor's office, it makes me a little nervous. That's not a reason for me not to have my blood pressure checked. And I think it's frankly a little patronizing.
Why patronizing?
Because women, adult women, are capable of understanding that sometimes we all have to do things that we're not crazy about, but there's a long-term benefit.
One of the big issues is false positives leading to unnecessary biopsies and potential harm and worry on the part of the patient.
I think in the contemporary time, in this day and age, a false positive mammogram is almost always solved with additional mammographic views and/or an ultrasound. And when the finding persists and needs to be investigated, again, today, typically the investigation involves something like a needle biopsy.
So not an excision where you have a big scar,
Correct.
just...
Not a surgical procedure, just a needle biopsy to sample the tissue and make a diagnosis.
And you do believe that it does protect you from dying from breast cancer?
There is an enormous difference in everything: prognosis, treatment, patient experience, between women who are diagnosed with early stage breast cancer and women who are diagnosed with late stage breast cancer. There's no question about it.